replace the bad switch. Speak directly into the mic.
Good evening, folks. Good evening. Thank you very much. I want to call the meeting of the Emergency Services Council meeting, June 21st, 2018. I'm going to ask Council Member Glenn Sylvester to lead us in the Pledge of Allegiance.
Of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much, Councilmember Sylvester. Can I have a roll call, please?
Atherton. Belmont. Brisbane. Burlingame.
Present.
Colma. Daly City.
Present.
East Palo Alto. Foster City. Half Moon Bay. Hillsborough. Menlo Park. Millbrae.
Present.
Pacifica. Portola Valley.
Here.
Redwood City.
Present.
San Bruno. San Carlos. San Mateo.
Present.
South San Francisco. Woodside. County of San Mateo.
Here. Thank you very much. I believe that's where we have a quorum. Is that correct? That brings us to item 2. Can I have a motion to approve the minutes from April 19th, 2018?
Second.
All those in favor? Aye. Any opposed? Seeing none. That moves us on to item 3, and that's the operational area report. Lieutenant Craig Denton. Good evening, Mr. Denton.
Good evening, Supervisor, and thank you everyone for being here tonight. Good evening. In front of you, as part of your packet, you have an attachment A. On attachment A, the numbers remain consistent with no issues really to address. We're happy with the way everything's going here in the fourth quarter. And if, do any of you have any questions regarding that document?
Are there any questions for Lieutenant Denton? Okay, thank you so much, Lieutenant Denton. I
And if
appreciate
I
it.
may, I would like to recognize Brad Hartzell, a battalion chief with the city of Daly City. He's been our OAS liaison for 2.5 years. And he is leaving OAS as the liaison. He will be retiring next week after 33 years of service to his community. So, God help you. In addition to that, I would also like to introduce you to our newest Office of Emergency Services District Coordinator Supervisor, Kevin Rose. Kevin comes to us from EMS in disaster preparedness of 12 years of service there. Prior to that, he spent 5 years as a Board of Supervisors legislative aide. And prior to that, he spent 2 years as Congresswoman Eshu's district field representative. So Kevin Rose comes to us with a lot of good experience and knowledge, and he's going to be an asset to our team. Thank you.
Great, thank you very much. That brings us to item 4, old business SMC alert. Jeff Norris.
Good evening, Supervisor Canepa, members of the council. Brian, if you could. So we've looked at the trend of our alerts, and we're in a very consistent with where we were last year in terms of the total number of alerts that have been sent. We're at 78 right now. Now, Attachment A does show 72, but in the last 10 days since Attachment A was prepared, we've had 6 more alerts sent to the public. One category of alerts are supporting notifications that we have done for Health Department. That number has declined dramatically because we made some changes to how the SMC alert is configured. We offered a configuration to the Health Department, and they're very effectively using it. It's really improved the efficiency of our system. So each member of the council has been provided with a summary of the number of full subscribers who are in their jurisdictions, as well as the population based on the 2016 census. And then we did some mathematics and determined how many percent of the particular population that is. San Mateo County on the whole is actually approaching 12% of its population as subscribers to the system. And this is actually an outstanding number because the national average is running around 6 to 7% for opt-in systems of our age. So I really applaud all the efforts that members of our council have done to help us promote that. Move on. And if there are any other questions, if you'd be I'd be more than willing to answer any questions, or if you want to catch me at the end of the meeting, we can go into details about anything you'd care to ask me about.
Great. Mr. Gree?
6%, 6 to 7% is the national average. That is. So we're actually approaching 12% of our total resident population, and 6 to 7 is the national average. So we're running about twice the national average. Now there are some communities, counties that are in, say, the tornado belt, they have very high subscribership. But in terms of comparable populations to the area that we have, we're actually well ahead of typical. Well, I would hope so, and I appreciate that everybody wants more subscribers on the system. We've really been promoting it. We're trying to get word out. We've actually incorporated the quick sign-in system for people who only want to give us a zip code. We're trying to make this the best system we can, and we're reaching out. So when we do have public event opportunities, we're definitely making sure that we're out there in the public, making sure people know that we have this system available.
Through the chair.
Yes. Ms. Chuang?
Thank you so much for the update. My questions to you is because of the emergency preparedness is so critical, and with all these natural disasters that's happening, is there any way that we can just automatically enroll people in? Because I know that in some other counties, they've done automatic and that you just opt out. And that seemed to be a faster way to do it. I'm not saying that, there are not going to be challenges. I was just curious as to, have you looked into other counties to see if there's opportunities for us to invite everyone in and then have them opt out if they choose to?
Okay, thank you very much. The great question. Other counties are actually modeling their system on ours, and we do have a completed agreement with FEMA to use what's called the IPAWS system, the Integrated Public Alert and Warning System. This is the nationwide opt-out system that's used for such things as Amber Alerts and for weather emergencies. We hold that as a very severe option for those circumstances that are very life-threatening. What we don't want people to do is opt out of the IPAWS alerts because they are regionless. If your phone is here in San Mateo County or if it's in Massachusetts, it can receive a message unless you've opted out on that device. So jurisdictions all across the country are being very, very careful about how they use IPAWS to try to minimize the number of people who would opt out.
All right, thank you.
Great. Yes, Ms. Keegren?
My question is that I actually brought this up in the last meeting, and I wanted to know if there was follow-through. Was it maybe beneficial to send a letter to all the city managers, strongly encouraging them to talk with their staff and their councils to promote the SMC signups? And has that been done?
So we actually reached out through our Emergency Managers Association to the emergency managers of all the different cities and towns, and that's an ongoing process.
Okay,
We
but I do think
we didn't reach
formal-
specifically to the city
Okay.
managers.
I think a formalized letter to the city managers, kind of increasing that awareness, may be beneficial, and maybe even encouraging them to put it on an agenda in front of the city council that is publicized, because people do watch our city council meetings. That may be an idea to put, forward to consider.
An outstanding idea, and we will take It's been captured in the notes, and we will do that.
Ms. Chuang.
Thank you. Just one quick note, quick comments, and that is, in the, all the cities, some has a higher sign up and some has lower. Perhaps that there's best practices that in your letter to the city managers, perhaps there are ideas that you can suggest other than just, ask them to do it. Because, the share best practices, sometimes it's very encouraging for people to come up with ideas. The assumption is that sign up for the SMC alert is a great idea, but the process can be daunting for some. I know that in my neighborhood, the experience has been the seniors has some challenge and confusion as to how to sign up. So it may be pretty straightforward to some, but it could be challenging for others. So the best practices would be a good thing to share if that can be included in the letter going to the city managers.
We've captured that, and we will consider that, definitely do that. One of the statistical elements that is a little bit anomalous is you look at the very high subscribership for Portola Valley and Woodside. Their fire district has a very great push in that area, and you have a more rural community that is at greater risk, and they realize that this is the tool that'll notify them in a fire. Also, they have a smaller population, so it takes fewer signups to have a higher percentage for a community. That said, we do want to make sure that we provide the best practices and best opportunity to make the system as successful as possible.
Great.
Thank you so much.
Thank you so much, Ms. Norris, for that presentation.
I have a question.
Sorry, did I miss someone?
Me over there.
Oh, sorry.
Sorry.
I wish I could bring you up here.
I assume that you're targeting teens as well as adults and kids.
We're targeting at all levels anybody who has a mobile device or a email account. And to that extent, we've actually gone so far as to include a QR code in our new logo because we started observing how young people were looking at a brochure and they were looking at it, and if there was a code there, they would scan it and leave the brochure behind. So we're trying to observe what the younger people in the community are doing and trying to take advantage of that. Further, we looked at how seniors might have difficulties getting opted into the system, and that's why we enhanced our easy opt-in system where all you have to do is text your 5-digit postal zip code to 888-777, and it's a broad brush. We can't pull the good statistics. It limits the way we can send messages to people, but at least it gets them into the system so we can notify them when there's an emergency.
I ask because my kids are the ones that hear about all these things at school and come home and make me sign up for them. And it might be good on a day when you have a fire drill, for example, and you have everyone's attention to when they get back, the teachers hand these out. And that way the kids sign up and they bring it home and they tell their parents too, because getting that younger generation on board, they will harass the parents until, I speak from experience, until you sign up because they're convinced that we have to be prepared for these things.
I like that idea, and I'll have to check to see with how we can do that in conjunction with our schools throughout the
If you
county.
did it through the school boards, I think they'd be quite happy to do that.
Okay, very good. Thank you. Thank you. I like that idea.
Sure.
Are there any further questions?
Are there any further questions?
Thank you
Seeing
very
none,
much.
Thank you for your
Appreciate the
presentation.
opportunity.
That brings us on to new business, item 1, FY 18-19 budget update. Please come up, step up, state your name.
I'm David Perrin with the Sheriff's Office. Good evening, Chairperson Kenepa and members of the council. As I introduce myself, I'm David Perrin. I'm the Management Analyst with the Sheriff's Office. I also have my supervisor, Narayan Nair, with me today. The following is a brief 5-minute summary of the proposed fiscal year 18-19 Emergency Services JPA budget. The Emergency Services JPA budget is funded through an agreement between the 20 incorporated cities and the County of San Mateo. The funding formula provides that the portion provided by the cities is then matched by the county. Additionally, a marginal contribution is received from the San Francisco International Airport. The proposed budget total is $2,834,960. This is referenced as a total cost share, and represents a $70,990 increase or 2.6% increase from the current fiscal year 17-18 budget. The Emergency Services JPA budget is presented in two parts: the Sheriff's Office of Emergency Services and the Environmental Health Hazardous Materials Response Unit. Also included is a small training expense allocation for state-mandated planning services. There is an increase of $41,789 in the Sheriff's Office of Emergency Services and is primarily due to negotiated salary and benefit increases, an increase to the North County Fire Authority contract, and modest adjustments related to various operational support charges. An increase of $29,196 within the Environmental Health Hazardous Materials Response Unit is due to an increase to the Belmont Fire Protection contract. By adopting the budget scenario utilizing revenues, the funding portion of the budget attributed to the 20 city agency totals $1,094,584, and the county share is $1,047,083. Reserves of $406,745 have been utilized, which has the effect of keeping the total contribution flat from the current year, with service levels remaining unchanged. A reserve trust fund representing surplus funds held by the Emergency Services JPA currently totals $633,604. These reserves represent the gradual accumulation of operating surplus, interest earnings, and revenue from the San Francisco International Airport related to emergency response services support. It is anticipated that future annual airport revenue of approximately $100,000 will be received. The council approved a reserves cap of $500,000 in 2017. The budget recommendation is to utilize reserves in the amount of $406,745, as this will allow the funding costs from the city agencies and the county to remain unchanged from prior year while keeping service levels unchanged. Future additional revenue for reserves is expected from the San Francisco International Airport. The Finance Advisory Group met on April 12th and recommended approval of this proposed budget. That concludes my report. I would like to thank Lieutenant Denton and Kathy Pape for the great work they do and the valuable help they provided with the information I needed for my report. I'm happy to address any questions you may have.
Are there any questions? Ms. Schneider?
I remember us trying to keep it flat last year, but we cautioned all the cities that there was probably going to be an increase. Then we had the fires up in Sonoma County. Is $500,000 enough if we should have any kind of big disaster like that? Will it give us the flexibility to get the services to our people?
The council may want to consider if they want to set a minimum level and allow the cap to be above that. So it might be a consideration to set a minimum level and then allow the reserves to go above it.
So if we're using the 406,000, that's bringing the reserves down to 227,000?
Right, and then there may be some operating surplus and additional airport revenues that would bring that up some.
I know that you all did a report last time, and I'm sorry I wasn't here because you talked about what they learned from Sonoma. But how quickly did they run through? Did they have reserves? Did they run through it? How quickly? I know they're still recovering. I'm just worried. That's all.
My understanding is that the reimbursements have been submitted and are being paid, so it does get reimbursed. The Sonoma fires did have some reimbursements that were received to help cover those.
What was the reason for not keeping the same 500 reserve that we'd agreed on last year and to allow it to go underneath $500,000?
That 500,000 was the cap. It wasn't.
It wasn't a, let's keep at least $500,000 in the
Right,
bank?
right.
Okay. Thank you.
Are there any additional questions? Mr. Sylvester?
Thank you so much. A couple of meetings ago, I went through this budget and I looked under services and supplies, and I had made a recommendation, given the emergency circumstances and incident that may arise, and I'm speaking to in regards to the Sonoma fires, to which most of the folks up in North County were affected via air quality. And I was just wondering if there's a contingency fund as such, whether it's for bottled water or N95 masks, so that we can draw on it in these unforeseen circumstances. And I don't see anything, for the cities or the counties. I believe Supervisor Canepa had to reach out to the Air Quality Management Board and got, I think, over 500 masks for up in the north. Would we consider something like that?
We have,
I can help address that.
Thank you, Captain Zamora.
Good evening, members of the council, Mr. Canepa. So what we're looking at, this budget is basically for the services that are described in the chart and nothing else. There are fire departments in cities that do have extra in their city budgets that could potentially purchase a surplus of different supplies for your own city. If we were to do this or consider it, then we would have to increase the budget, and then the JPA would have to add additional monies into the budget. So it's something that you may want to discuss, but realistically, I think that if each city kind of allocates their own funding for supplies as such, then the JPA would not increase its budget.
Mr. Sylvester?
Thank you very much for the explanation. As I'm pretty new here, can you advise as to how these numbers are determined? Is it by population?
it's part of it is assessed value of property, and part of it by population.
Okay, and have we did a study on determining the amount of calls for each particular city and the use of resources, other than the reports that come out every month, like SWAT call-outs? Do we break that down as to the calls per city?
I can determine that information and relay it to you.
Thank you so much. I have no further questions.
Great. Are there any other questions, Mr. Gree?
So I guess the question really is, since I know I'm not that clever at figuring this out, so, but from all of you emergency services persons, board member Ann Schneider's question is about, is the reserves good enough? Are the reserves we're voting on good enough, do you think? I mean, I live in an erosion city, but I also hear every day that the earthquake is tomorrow.
Right, we can't project all the costs that it might be in the future, but the reserves are reasonable to help supplement costs. It can't cover all the costs, but there is a reasonable level of reserves.
In this particular item, are you asking for us to take action on the FY 18-19 budget? It says update, but I'm wondering if you need a motion or to move this forward.
It's for approval.
For approval?
Yes.
Can I get a motion to approve this item? Second by Gauchier. All those in favor?
Aye.
Any opposed? Great, thank you very much. That brings us on to item 2. It's the OES calendar. Mr. Rose.
Great. Good evening and thank you. And years as an observer from the cheap seats to the podium, dreams come true. So if everyone I please hand out to reference here, what I want to do is talk about the Yellow Command exercise that's taking place on September 6th, 2018, and sort of follow along with the bolded items. Yellow Command itself, it's a regional operational area exercise funded by the Bay Area Urban Area Securities Initiative, including the 14 Bay Area, Uwasi counties, Bay Area, and then extending down to southern region, held in September in conjunction with the Urban Shield, the 2-day SWAT exercise. Past exercises have emphasized points of distribution, terrorism incidents, mass casualty incidents. This is the 5th year, second year actually dealing with mass care and shelter. And the scenario is basically 4 days after a major earthquake. The participating cities and town were 18 for 20, hoping to go 20 for 20. By the time we reach there, there's still time. We are in the planning phases. For the most part, the cities listed will be testing anywhere from actual emergency operations center activation, communications, utilization of WebEOC, resource requesting, situational awareness. If you have shelter listed in parentheses, your city's activating a shelter and testing its capability 4 days in as far as what capabilities they have and what they will need from the region and the state. The County Emergency Operations Center, our activation, Office of Emergency Services, we establish it itself. County Manager's Office, we're very fortunate with our communications officer to be having a joint information system, joint information center with cities invited that testing messaging not only within our own operational area, but also within the region. And they will have what's called a simulation deck, basically an online version of social media, pre-scripted messages for them to react to and to develop messages themselves. Included within our Emergency Operations Center, we'll have our Human Services Agency, who's represented today. They'll be the Care and Shelter branch. They'll open up their own Department Operations Center, and then they'll have 2 virtual shelters, basically for us to have fake shelter victims to utilize our services in dealing with their individual needs. Our health system, represented this evening as well by Emergency Medical Services Agency. They will be activating the Medical and Health branch, assisting in that capacity. Coroner, you don't want the coroner here this evening, but the coroner is participating. She will be within the law branch, testing with regards to decedents and any shelter assistance. Peninsula Humane Society, a very important part that came from the North Bay fires. They are not only also going to be in our Emergency Operations Center, they're going to attach themselves to one of the shelters with an actual field deployment, basically to see how they can interact and with their staff. American Red Cross also here this evening. They will be agency representatives within the Emergency Operations Center. They'll have their own Department Operations Center activation for situational awareness, as well as shelter operations, again, with the shelters being there in person and helping with the virtual shelters as well. FEMA Region 9 and California Office of Emergency Services have been invited. Cal OES most likely will have a representative in our Emergency Operations Center. And the excellent part about that is that the state is activating their State Operations Center. And so we will have communications and resource requesting going up and also hopefully coming back down, but a way for them to test with regards to the regions and the state activation 4 days in with what type of help they would be able to provide and what type of help the feds would come to us. So the objectives at the very end, EOC activation and support and care and shelter mission, information sharing, situational awareness with reporting, federal, state, operational area coordination, even down to the cities themselves and even to the field with the shelters themselves that are being activated, and then the mention about the Bay Area Uwasi Joint Information System and the Joint Information Center. Other things to mention as well, September 22nd, Saturday, from 10 till 4, our annual Disaster Preparedness Day. And we are in the planning stages with Supervisor Carol Groom's office and the Board of Supervisors. With the cities, we're working with your participation, presentations, instructional classes, CPR, Stop the Bleed, first aid, awareness. We'll also have informational booths inside for the cities, for stakeholders, for CERT teams, basically to provide information to the public. We'll have outside exhibitors, apparatus, equipment showing your wares, and basically educating the community throughout the day. And with the success coming to a supervisorial district near you of the April 30th Mini Disaster Preparedness Day that Supervisor Canepa held up in Skyline College, there has been other expressed interest from other supervisors in doing something likewise. And we have historically done so on the coast with the Mini Disaster Preparedness Day. So the Honorable Chair has started something. And of course, with Supervisor Groom in the center, the big Disaster Preparedness Day, but essentially we will continue to provide information on that.
I have a quick question, Ann. Are you, I think this is important what you're doing on September 6th. And, as a member of this particular board, are we all going to get invitations to maybe potentially look at sort of how this is implemented and how this is operated? What's the plan regarding that?
So for the Emergency Operations Center, am I receiving a volunteer for our EOC?
I think I think you'll be receiving a lot of volunteers. I'm trying to set it up for you here, Kevin.
Thank you.
All
Yeah,
right.
we would absolutely love for you to be there to observe, to witness the Emergency Operations Center. Admittedly, ours will not be a full EOC activation. We are, as we're trying to do, bring on board other departments to help, in essence, of our support more so for the shelter operations rather than the actual EOC focus. So it's more of the situational awareness. We'll be very active on Web EOC. Our communications director will be very active with the region towards messaging with your city PIOs invited, and within your own cities through your emergency managers, very much so they would welcome your observation, and we can help in that capacity.
That'd be great if you can send some correspondence out to the board members just to inform them how that's going to be, how we're going to push that forward. That'd be great. Ms. Schneider.
I think we were thinking along the same lines. Last week, the president of the Sonoma Board of Supervisors talked about another lesson that they learned, and it was that their local city elected officials and their county elected officials didn't know what to do and didn't know where to go and or the first responders weren't communicating with them. So I like the idea of being an observer, but I think if there's time to actually give a role play for the elected officials. I know when we had our fire, and as a former Red Cross disaster volunteer, you don't go until you're called out. But I know that some of my fellow council members were there as the firefighters are trying to put something out, basically, maybe not, but possibly getting in the way. So I have been worried about that ever since. We need the training to know where are we supposed to go, how are we not to get underfoot, but also the media is coming to us. So when do we shut our mouths? When do we point to the PIO? All of that kind of training is important if we get the big one.
Yes, thank you. And we are in the planning phases, and what we can do is, most of you are very familiar with, develop injects that we share within your emergency operations center that we can do so here. Not to show the hand a little bit, but there are some elected official injects we are including about to have a press conference or not, how to do so, the collective messaging, what type of messages to push out. And some of the important aspects, especially with elected officials, is more so of bringing the attention to areas that they may not be receiving it. And in case in point, the Napa earthquakes coming from EMS, truth be told, the vision that they had was only within their county. They thought other counties had been impacted as well, not just themselves. So they limited their resource requests. They're limited their pushing out of information, asking for more, because they thought others were impacted. And so had they had that awareness, they could have asked for the moon and basically gotten it.
And I don't see CERT on here. I know CERT just had Green Dawn, but is there a way to fit CERT in?
So Health has done a fantastic job of utilizing CERT, where they have the thunder that you're about to hear. This one is really more of the emergency operations center function versus within the field. However, to your point, CERT members are becoming more and more trained in incident command system where they can fill those emergency operations center positions to help city staff, disaster service workers that come to the fore.
Great. Are there any more questions? Ms. Keegren?
I just wanted to know, what time is this command exercise on the 6th?
So the county itself will be going from 9 till 3, and then your various cities will have a time fluctuation. But what we will do is, once we have that finalized, is share with the Emergency Services Council all of the cities, hours of operation, and probably more in-depth information of what it is each of you will be doing for the exercise.
Okay, great, thank you.
Great. Thank you very much for that presentation. That brings us to item 3, Green Dawn.
Good evening, Supervisor, council members. I'm Nancy LaPaula. I am the EMS Agency Director for the County of San Mateo, and it is a pleasure to be here and to share with you our Green Dawn exercise, which is truly a collaboration of your CERT teams, County OES, and many other, our hospitals and our healthcare coalition. So we're really proud to be able to share the work that we do. But I wanted to kind of set the stage a little bit and share with you that the health department for the county is your health department, the city's health department. You all don't have individual health departments, we represent that part of your emergency response for the whole county. And so what you'll see in some of the slides today is the health department is the medical health branch of the county's emergency operations center. And so we work very closely with your fire departments and your CERT teams to help us fulfill some of those roles. But just like your fire departments or your law enforcement may have a department operations center because they're very field focused in working to do that work, the health department also is very field focused and really doing that work out in the field for communicable disease or infectious disease outbreaks, or managing with our hospitals on where patients are going to go in a large event. So those are some of the things that we work to coordinate and make sure that the health system as a whole, both our public and private entities, are all working together. And so you're going to see a little bit more of that. And I'm going to hand the mic over to Dr. DeParcara, who will share what a great exercise we had and how we really were able to work so collaboratively with everyone.
Good evening, Supervisor Canepa and council members. I really appreciate this opportunity to present on the Green Dawn exercise. It was a simultaneous attack on the parks where there was a fun run and the CERT members were already there. So what the city CERT folks did was basically light search and rescue and triage and treatment. So they got just-in-time training with AMR and had this great collaboration of how they would do handoffs with the first responders. We also activated the health system DOC, Department Operations Center. We opened up a family assistance center. Actually, Red Cross opened up a family assistance center, and we deployed behavioral health folks to the family assistance center. In terms of medical health operational area coordination, we tested with EMS, so our ambulance contract provider, AMR, health system DOC, so that includes anything from behavioral health, environmental health, Red Cross, and our healthcare coalition. Our San Mateo County Healthcare Coalition is a coalition of healthcare facilities, hospital, nursing homes, long-term care facilities, and stage dialysis centers. But we have 54 actively participating facility coalition members. We also tested the JIC, Joint Information Center, AMR, OES, the coroner's office were all activated to support our play. The JIC was activated. There was joint information flowing, both at the city level. Red Cross PIOs were there, the sheriff's office PIO, and then the CDC quarantine station also sent someone there to just have this conversation. We also tested redundant communication with ham radios. Both OES and Red Cross simultaneously participated in testing their ham radios, so which was really good communication. Just regular trunk radios were tested. ReadyNet, which is our emergency communication system for the EMS, was tested. SMC Health Alerts, which is part of SMC Alert, was also tested. Volunteer management was tested, and GIS mapping was tested with our collector app with our county GIS folks. With our health system function, we have something called a health system duty officer, scout, and those two are initial responders to any kind of county-wide disaster. So those programs were activated. The policy group was activated that made decisions on how to proceed with this scenario and set objectives for the health system DOC, which was intel gathering, sending behavioral health response, resource tracking, personnel tracking, and coordination with the hospitals and healthcare facilities. We also simultaneously, on top of this exercise, also said that we were going to evacuate Seton Hospital. So, and that was a no notice evacuation. So,
How did that go?
So 20% of Seton Hospital was asked to evacuate their paper patients, and they were able to place all of their patients within our healthcare coalition. And if need be, we could always, with the help of participating coalitions in the Bay Area and also ReadyNet, we could have placed those patients throughout the Bay Area. So it just really speaks to the strengthening of the San Mateo County's healthcare coalition. In terms of our DOC, one of the things that I'm proudest of in our DOC is we came up with a demo plan on the spot, how to demobilize the DOC in when you have no papers or no plan. So which was really interesting. The MOOC situational report, which goes to the state, to the region, and then to the state, was also developed. Completion of the ICS forms, specifically the 214s, which is really important in reimbursements, was also tested. Great collaboration with Red Cross, OES, Coroner's Office, and the Healthcare Coalition. Some of the field functions that were tested. So CERTs set up initial incident command and integrated under unified command. That was simulated. Light search and rescue, triage of mass casualty incident victims, first aid and treatment, and also staff tracking, which was very incredible. They tracked each one of their CERT members, even though they're from different cities, they were able to do that, which was phenomenal. They actually lost 2 people, but then found them, so that's good.
That's cool.
The GIS field mapping, this was the first time we used this. This is a collector app that belongs to the County of San Mateo, and we were able to tag, this is where the victims are, this is where the deceased are, this is where we found the black box, things that we could use in a real emergency. Resource requesting from the field to the DOC was phenomenal. The OES provided great mobile communication with their command unit, which was able to help the coordination of communication, and the handoff to the first responders was tested. These are the list of the participants. We had about 253 participants total, and we're really grateful for the participants. These were the list of the participants. And then these are all the healthcare coalition participants that actively placed patients, even though all of the 54 facilities were actually standing by to take patients. That concludes my presentation. I want to thank everyone for a very strong collaborative exercise. This helped deepen our capacity, and it really identified some things that we're going to be working on in the future. So really appreciate your time.
Great. Mr. Gree.
That's very impressive to do that with Seton Hospital. I'm really impressed. Question, so I'm assuming, do I just like comfort, for the special needs populations, were they involved in any way? That would be people with autism, Down syndrome, cerebral palsy, that type of thing.
So for this exercise, we did not involve them. We do on a regular basis, at least twice a year, sometimes more often, present and do workshops at the centers for individuals with disabilities. And we also have special flyers that are for individuals with disabilities that we pass out at all events that we go to. One of the things that we're working on is we've identified about approximately 10,000 clients that are severely dependent on power or other things that we are hoping to interface into SMC health alerts that we could use in case of a disaster. One of the things that we could have used that function, like last year when we had the heat wave, we could have sent out a message saying, "Are you okay? Do you need a fan?" instead of the health system calling each of them individually. So really want to appreciate OES with helping us get on board with that and trying to make that happen right now.
I'd like to also mention that Pacifica recently created a registry for our special needs individuals. That would be both the folks I mentioned and also mental health. Well, maybe I could send that to you, David. That maybe the county and other cities might that might be very helpful for you. Thank you.
Thank you.
Are there any additional questions? Janet?
So yes, to Mr. Griescom, I totally support that. And a little bit further than that, they're also hearing impaired and a sight impaired. I think those are two areas in our population that we tend not to pay attention to as much in some of these exercises. But if you could go back to the slide that showed the list of that one, I think that was it. I am really impressed. I've been sitting here wondering, did they get long-term care homes? Did they get nursing facilities? Yes, thank you. That is huge, and sometimes we actually forget to involve them in the actual exercise, and knowing that you have done that and brought them on board, I feel a little more comfortable. Because I think it's imperative in all our communities that not only do we know about our local neighborhoods and who may be possibly physically limited, but our skilled facilities, as we've heard, there were some problems in some of the last disasters, and we want to make sure that we move forward and make this so it doesn't happen again. So thank you.
Thank you. And we've actually been recognized by the state for expanding our coalition for skilled nursing facilities and the 17 provider types. And we just recently got awarded for promising practices as of a couple days ago. So
Congratulations.
Thank you.
Could I ask one more thing? Oh,
Yes, Mr.
I think
Green.
Ann was first.
Oh, no, Ms. Schneider.
Can I get a copy of your slides?
Absolutely.
Thank you.
So again, I'm looking for comfort because the county has done so much for veterans with PTS. Has that come into play in any way? I was just wondering if we're keeping tabs on how that might affect veterans when there's a disaster.
So I think that's a really great question. We are working on creating a plan for addressing the medical and behavioral health needs of the sheltered population when they get displaced, because that's when a trauma occurs or stress occurs, that's when you see things like this happen. We've also invested in working really closely with our crisis response team, which is our behavioral health team that goes out. So, for example, during the YouTube shooting, they were deployed and they took care of, groups of people, like 60 people in a group, a couple of times, and then they did individual counseling. So we're always looking to explore new avenues and continue to be the behavioral health support. And this exercise particularly was very important because the integration of Red Cross and our behavioral health folks and how they basically communicated with each other and then passed that information back to the DOC, I think is very important. So we're continuing to work on our behavioral health initiatives.
Great. Yes, Ms. Carlson.
I sit on the board of the Vista Center for the Blind that provides services for the seeing impaired for the Bay Area, basically now. In fact, we have a board meeting tonight. Maybe the people that run Vista know, but I don't. Do you have any plans or ways that you reach out or support the blind in the case of an emergency?
That's a very interesting question. I don't know the answer to that, but I will look into it and get back to you.
Okay, and I can take it to the woman that runs the center as well. Maybe that's something that we can look into, because as a city, we're working now to improve our websites and how we communicate with the seeing impaired as well.
Yeah.
Thank you.
That's a great suggestion. Thank you. I appreciate it.
Great. Thank you very much for your presentation, and congratulations on the award and the recognition. I was actually there to sort of witness it. It was in Juniper Serra Park, and I think what was being demonstrated was that there was a plane crash. And so I think for us, where I took a lot of comfort in was that we had a lot of CERT members from different cities there. And to kind of see how they worked diligently and thoughtfully and sort of using the technology around the GIS and collecting various items. And it wasn't just, tagging those that were injured, but more importantly, outside of that and making sure they were secure, was just I think when I saw something tagged, it was like a engine or from an airplane, it modeled something. But just thank you for all your work, your hard effort, and continued success. That being said, I do want to kind of find, if you can circle back with us at another meeting, some of the things that you think that should be improved upon. And so the outcome of that will make us stronger in the future. So thank you very much. That moves us to item 4, Emergency Managers Association update. Thank you, sir.
Hi, good evening, Supervisor Canepa, members of the board. I'm Captain Pat Halloran. I'm the emergency manager for the city of Belmont. I'm also on the board of directors of the Emergency Managers Association. I just have a couple of items to update you on regarding the association. We have a new president for 2018-2019 who was elected today, and that's Ken Anderson, who is the emergency manager for the city of South San Francisco. And the new board will start immediately. We work on a fiscal year basis. So some of the items that we're working on right now is the association is working collaboratively with the Red Cross on a revised shelter intake form, which is seems like a very simple document, but it's important to get that kind of information when you take someone into a emergency shelter, that you capture the right information so that we can assist them, document their needs, any special issues that they have. So we're working with Red Cross. There's currently a form in place, and we're trying to make it better so that it's more useful for everybody and that it's standardized throughout the county. We're also working on an EOC section checklist our planning group is working on, and that's going to be rolled out in advance of the Yellow Command exercise. We're planning some EOC section training that's going to be available to all of your city staffs through the Emergency Managers Association. The checklist is basically a reminder, because most of your city staff, although they're trained on how to work in an EOC, it's not something they do frequently. And when they are called to work in an EOC, it's under stressful conditions. So we're developing a checklist so that they make sure that they catch all the important points and have something to rely on just to help them get through that assignment. We are also working, we have an alert and warning working group that started after the incident with warning in Sonoma. Our group has expanded. Originally, it was emergency managers that got together for this. We now have a fire chief on the board. I'm the law rep. We also have people that are involved in mass communications. We have the communications officer from the city of South San Francisco, and Michelle Durand, who is the county's PIO and communications director. Because we're not just looking at SMC alert, but we're looking at all the ways we communicate with the communities, whether it's Facebook, Twitter, Nextdoor, all the mass communication. And the idea is to get a standard operating guidelines so that it's consistent for the users, the cities and the county, but it's also consistent for the public so that they know when they get an SMC alert or an alert that if it comes from Belmont or Burlingame or Portola Valley or Redwood City, it's under the same circumstances with the same kind of information so that they can rely on what they're getting. So, and that's the end of my update. And if you have any questions.
Are there any questions? Great, thank you for your report. That brings us to American Red Cross update. Is Mr. Fanai here? No, he's not. Okay.
Mr. Chairman and council members, I'm Jim Holly with the American Red Cross, involved with community relations and government liaison. And I'd like to give you some information. The first thing I want to talk about, and I think our council member from Millbrae knows about this, we're most visible in the community because of our work with home fires and home floods and these individual small disasters. And since January, we've had 14 of these, both single-family and multifamily homes. By jurisdiction, we've had 1 in Burlingame, 2 in Daly City, 2 in Redwood City, 2 in San Bruno, 1 in San Carlos, 1 in South San Francisco, 3 in San Mateo, and one of those events in San Mateo was a approximately 35-unit building, condo building, and it resulted in 25 cases for us. And we're pleased to announce that all those cases are settled except for one, and people are on to total recovery. It's mentioned in your material that's passed out that in addition to the local work we do, the local response we do, we respond all over the United States. And we've had local people in Florida, in Texas, and some of the other southern states. We had a few folks even in Puerto Rico. And the people that we send are not just shelter workers. We send logistics people, we send communications people, computer people, and a big number of folks that we send are mental health people as well as health services people. Now, in terms of the fires up north, in your information there, it talks about approximately 2,300 Red Cross volunteers were up there working. 70 of those folks were paid employees. The rest were volunteers, and they came from all over the United States. And it really impresses me that when we have an event like that, suddenly it's full of Red Cross folks. And since we all use the same training material, it's just a handshake and a get to work. So I also wanted to tell you about a very successful program. I'm sure you all know about it, and that's our home fire program. And we go into neighborhoods, usually with a partner. A partner could be a fire department, a CERT team, could be a couple of partners. And we install modern fire alarms. These are the fire alarms with a 10-year battery. And in addition to installing the fire alarm, we also do kind of a mini disaster preparation program, an evacuation plan to get out of the house and what people should be having to prepare for a disaster. And we visited 463 homes and installed alarms, which in terms of our goal, we were 52% over our goal, which surprised us. And we installed 1,542 alarms, which is 104% over our goal. And I've got to compliment the coast side because in the coast side, we installed alarms in Montera, El Granada, Half Moon Bay, and Pescadero, and other places. South San Francisco, San Bruno, Millbrae, Burlingame, San Mateo, Foster City, Belmont, Redwood City, and East Palo Alto. So we got around the county quite a bit. I think you also know we do quite a bit of training, and aside from first aid and CPR training, we train something like 2,200 people in a variety of programs, including a sort of a mini hands-on CPR program that we can do. It's not a certified program. We have food safety we do disaster preparation, we have a psychological first aid program that's really valuable and popular, and several other courses. And these the sites for these classes vary from senior centers to mobile home communities to city situations, and we've done several cities, including we've provided help to the county as well. The county is a strong partner of ours. One story, it was kind of a remarkable event for us. Some adult school had 12 classes. They wanted 12 presentations by us in our disaster preparedness group. And a volunteer went over there, and in 2 days, he did 12 one-hour classes and did 400 people, which we were quite impressed with. He's become our new hero. We've also been active in events. We participated in the Coastside Earthquake event, which was organized by and structured by OES. And most recently, we participated in Green Dawn, which is a rather large, complicated, comprehensive program, as we've just heard, put on by the Health Department. We'll be participating in Yellow Command, which is coming up. And in addition to these bigger events, we also go to preparedness fairs that cities might have, or I attended recently the opening of the Pescadero Farmers Market, and we talked to almost 40 people there. And so anyway, that's basically my information for you. Are there any questions that you might have?
Yes, Ms. Borgens.
Thank you. Could you explain to me what settled means? You said you had several cases that and they're now settled. What does that mean?
Well, we respond to disasters, and then we participate in recovery. And when I talk about settled, we've taken a family in, or an individual for that matter. We've used other community resources. We might use Samaritan House or some others. And we get the person focused on new housing. We get them focused on clothes. Sometimes it's enrollment in a food program of some sort. But anyway, when we're done, we've essentially got the recovery program to a place where people can be self-sustaining. Now, I'm not saying in every case that everybody just wanders off with a smile on their face, completely recovered, but that's what I mean by resolved.
Okay, so, and then I have another, a lot of these things that you're accomplishing, which is amazing, by the way, you have a lot of partners that you depend on to make a lot of this happen and be successful, which is a good thing. So is that correct statement?
That's absolutely true. We're a partner. Two things that make us unique. One is we work through partners, and probably everybody in this room is one of our partners. And we also work with volunteers. Approximately 92% of our staff are volunteers. And we work with a lot of people, most of the community services agencies, the Peninsula Humane Society, lots of organizations.
Good. And then one other question, with the alarms that you installed, were these the hardwire, or were they battery, or were they the
battery,
current?
and they have 10-year
the 10-year,
life
and they're
batteries.
carbon monoxide, and I don't know what they're called.
No, there's no carbon monoxide in these.
So it's strictly fire alarm.
Strictly fire. It's essentially a detector, a smoke detector.
And those are in single-family homes or apartments or?
Apartments, single-family homes, and there's no economic ceiling on it, or if you need a fire alarm, we can respond.
Good, okay.
And typically it's by group.
By group, did they say?
Any other comments?
Great, thank you for your presentation, okay?
Thank you.
Okay, that brings us to public comment. I don't see any public comment. Are there any public comment cards? Thank you very much. That moves us to announcements. Are there any announcements from the members? Okay. I will tell you our future ESC meeting will be on September 20th, 2018. With that, can I get a motion to adjourn?
Motion.
All those in favor?
Aye.
Thank you very much.
All right, back to work.
Yeah.
I will go back and talk.
More work.
More work.
Never dull moments.